Valley fever is a common fungal infection that we diagnose here in the desert Southwest. Also known as coccidioides, this is the distribution. One of my favorite resources for talking about valley fever is the Valley Fever Center for Excellence. This is located in Tucson, Arizona. Valley fever is a fungus that's just in the soil here, and dogs are exposed by breathing air. Some dogs are able to clear the infection with no clinical signs, but it is estimated that 6 to 10% of dogs living in Pima, Pinal, and Maricopa counties will get sick with valley fever every year. And right now there's no prevention, but they are working on a vaccine. Symptoms of valley fever can be broad and kind of vague, with most dogs developing like a pneumonia, and on x-rays you can see the lymph nodes, the perihilar lymph nodes are enlarged. It also likes to go to the bones, so sometimes you can see bony lesions that look cancerous. It's also been known to do lots of wacky things, like cause pericardial effusion or fluid around the heart, or seizures if it gets into the brain. Most diagnosis is made off a blood test called a titer, though you can have false negatives. And you can have a positive titer from exposure, not necessarily illness. Generally, we treat these dogs with fluconazole, which is an antifungal medication. And most mild cases resolve, though I have had several patients that are on fluconazole lifelong. And even if you don't live in the desert Southwest, you should get a thorough travel history on all your patients, because we have a large population of snowbirds. So you may diagnose this even if you live in a state with lots of snow.